Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Today's programming is on pulse and tongue diagnosis within Chinese medicine. For many years, we've been doing this programming, and a lot of our focusing has been on acupuncture, treatment of specific conditions using Chinese medicine and Chinese herbal medicine. One of the more common questions that we have coming back to us, both in the office and from the viewers, have been, we want to know more about this whole thing with the tongue diagnosis and the pulse diagnosis. It was too much for us to integrate an in-depth discussion on these diagnostic tools when we're treating specific conditions, as it didn't give a global overview for what was necessary to get an understanding of it tonight. So what we're going to do is back the train up and go over it completely so that you, as the viewers, have a much greater understanding. Also, keep tuned at the end of this program, because if you call the number on the screen, you'll be able to get a home companion that will allow you to do self-study in this regards for your own use at home and within the family. Traditional Chinese medicine is the longest, oldest form of medicine known to mankind. It's been in existence for over 3,000 years. People got sicknesses and illnesses back then just as they did now, but there wasn't much they could do. What they found is that through observation of signs, symptoms, complaints, and through diagnosis using the pulse, which we'll be explaining, and tongue diagnosis, they were able to formulate treatment protocols using herbs and acupuncture that gave them a much greater ability and assessment to help people with their problems. Chinese herbal medicine is used just like Western medicine has been used nowadays, where people came, they had complaints, they found out if they ate a certain root or they ate a certain herb that they were helped with that condition. And part of the tools is pulse and tongue diagnosis is what they would help. Now, I've been doing this work for about 24 years, and it always interested me because about 20 years ago, I went into Manhattan because I wanted to go to a Chinese herbal specialist. And when you go into there, you go into Chinatown, and you go into a room, back room, and there's all these herbal cabinets with all these herbs, and there's usually an elderly Chinese man there. And you sit down, and he listens to your symptomatic complaints. And then what happens is that he looks at your tongue, takes your blood pressure, does your pulse diagnosis, writes a Chinese herbal prescription that's given to his assistant. And then what happens is that the assistant goes through all these drawers, and he's taking handfuls of herbs, and he's putting it in all of these brown paper bags. And these herbs then are going home for you to boil. Boil up these herbs, drink these 3 times a day to help with the condition. And you know what? It does. The role of Chinese herbs is one that has low toxicity, high efficacy, and it is something where it is a tremendous complement to Western medicine, because it treats things that a lot of what Western medicine doesn't get, it treats better. So what they found out is that there's 2 components. There's the pulse and the tongue. In tongue diagnosis, what we find out is that when we look at the tongue and analyze the tongue gives us information on what's going on within the body in a more long-term or static time period. And what that is, it's like if we were to cut you open and we were to look at an organ, is that organ healthy and right, or is that organ diseased? And the gross morphological findings, is that off? Meaning the way in which it looks, is that off? The unique thing about the tongue is that there's so much interaction that goes on within the mouth that the tongue changes color, shape, size, configuration, coating, all in response to what's going on in the body. And not only that, it changes when it's getting worse, and it changes when it's getting better. So when we're talking about the tongue, first of all, we're looking at the size of the tongue, how it is. Is it big? Is it swollen? Is it thin? Does a person have good movement to their tongue? The general constitution of the tongue. The next thing we're looking at is the color of the tongue, and this is very, very important. The normal coloring of the tongue is slightly red with a thin white coat. Now, when you look at tongues all day long and you see thousands and thousands of tongues, you really, really get an eye for what's going on within that person. So the coloring of the tongue is important. Normal reddish, slightly red, thin white coat is normal. The other things that are normal, some people have like the papillae, or what's your taste buds, can be raised on some people to a very large extent, and some people it's barely there. That's normal. That's a normal variant from person to person. Another thing that's normal is that a person that has a geographic tongue, or a tongue that has bare spots in it, it looks almost bald, free of any taste buds, that in most people is a normal variant. That is not indicative of a problem. The only time it is that if a person has extreme heat in their body and has a disorder that's been there for a very long time, that could be a component of it, but usually that's not a problem. So what we're looking at after the coloring of the tongue, which could, if it's purple, it could indicate stagnation within the body, or a non-proper blood flow into that region where the blood is not flowing freely in the body. It's a common finding both in cardiovascular disease, and I don't know why cardiologists don't use it more, because it's a very valuable tool of whether blood thinners are working, if a patient's getting good oxygenation. Tongue coloring, and it is just a very important aspect. If a tongue is pale, it indicates that the person has either deficiency-oriented problems in the body, meaning a lack of resources, a lack of energy, a lack of blood flow, a lack of vital resources to their health, so their tongue will turn pale. If their tongue is extremely red, that would be indicative of heat symptoms in the body. And those heat symptoms would be indicative of either a fever, too much raised temperature, the body's systems are working too hard, or the energy, too much energy in the body is creating excess heat, and it's causing symptoms from circulatory systems to problem in the liver, to frustration, and to emotional problems, a whole gamut across the board, just from the fact that their tongue is too red and you got too much heat. Another common finding of what we see is that we're checking for the coating of the tongue. Thin white coat is normal. What do we see when we see a thick white coat? That would be indicative of an external problem invading the body, such as a person has a cold or a virus, but they have cold-oriented symptoms, chills, without fever, because what happens is that there's cold or deficiency in the body. What we see, if the coating of the tongue, a person sticks their tongue out and it's very, very yellow, that would be indicative of heat symptoms within the body. So a person's definitely going to either have fever or be hotter by nature, or if they have a sinus condition, it's going to not be that they're going to have not a thin, watery discharge. They're going to have a thick, mucoid nasal discharge, because what's happening is that there's heat and swelling and fever somewhere in the body. A common symptom that we see, which is indicative within our society, is that we'll frequently see ridges, and we're going to be going to some plates later on, and those plates are going to give you a full indication, a diagnosis, so you're going to see close up. Those ridges are indicative of whether a person is depleted through overthinking, overwork, whether they have problems in regards to headaches or tension, whether they have abnormal stool findings. Also, when we look at the tongue, you would think that the tongue would normally be wet all the time. There's such things as a dry tongue, and there's such things as a wet tongue. And that would be indicative of whether a person's getting enough water in their system, whether they're drinking enough water or fluids. It's also indicative of whether the health of the stomach is functioning properly. When the health of the stomach is off, it's going to change fluid accumulation in the mouth. And there's a signal between these two regions that give us diagnostic qualities in helping the patient heal themselves. So it's not just the size, the movement, the look of the tongue, the coating of the tongue. Now we're going to get into the more interesting part. And that is the Chinese, through observation over the years, have broken the tongue down into specific regions of disharmony. Now, what happens when we look at the tongue, the tip of the tongue problems on the tip of the tongue may be indicative of a weakness within a person's heart, or whether they have problems emotionally. And I found this to be a one-to-one correlation. A person has little red spots on the tip of their tongue, or this is slightly red and this looks like it's on fire or purple. There's some emotional issues going on. There potentially could be an underlying heart problem going on, or some form of cardiovascular weakness. I found this to be very, very true. This region, after the heart region, is related to the lungs, and what we'll see is either small cracks. We may see some fissures into that area. We may see discolorations as opposed to this area as opposed to the other regions. And when we see that, it can frequently correlate to some type of organ weakness within the body. This right here in the center is known as the spleen region. And what that relates to physiologically is that it gives us a tremendous amount of information on how the person is digesting. Are you digesting well? Is it an enzyme-oriented problem? Is a person having too much mucus in their system? Is a person not absorbing properly of the nutrients involved? Are they eating too hot foods, too cold foods, too spicy foods? All of these things we can get through looking at the center of the tongue. Through the discolorations, we can tell whether a person is having excess heat or whether they have a weakness dealing with too much or too little energy in the body. So the spleen is what the Chinese use predominantly for pancreatic function and functioning of the digestive system. The lateral regions of the tongue correlate to weaknesses that may occur in the liver. And by checking out into this area, we get advanced notification of whether the liver is functioning properly, whether there's disharmony within the meridians or channels of the body. So there could be a problem just with the energy that needs to be treated with herbs or acupuncture, or it can be dealing with an overt weakness of the liver itself. On the way over, I was trying to formulate a good example of how to tie this all together. And one of the more common things or diagnoses within our society is something called constrained liver qi. It deals with a lot of tension, a lot of excess overworking for a long period of time, frustration, anger. People get a lot of headaches. Women get menstrual problems, breast distension. But this whole thing of a lot of frustration brings up this diagnosis called constrained liver qi. So what we find is then the tongue looks like it's purple. It looks like it's swollen, and it looks purplish. And when we diagnose and do the pulse diagnosis, which we're going to do next, is that what we find is that the pulse, what they call a wiry pulse. Now, how that all ties together is that when the liver is under stress, either chemically or emotionally under stress, it isn't functioning properly. And just like an oil filter in a car that's clogged, it creates back pressure. And where does that back pressure go? That back pressure goes up. And that causes a lot of headaches. It causes a lot of heat, anger, frustration, memory problems. And what we see is that the tongue is not getting the normal blood flow, so it turns purple. It all makes too much sense. And we get vasoconstriction, and then we get a wiry pulse. And it all fits together in a pattern that then allows for us to treat the condition. Another thing I was backwashing the pool today, and the pool heater wasn't going on because the pressure was up too high. You backwash the pool, you clear out the liver, whether it be the liver as far as organ or within the meridian theory, and everything flows. You get a free flow of energy, a free flow of chi in the body. So that's how that all fits together. So then this other region right here, this is known as the kidney region of the tongue. This is in the back or posterior area of the tongue. The kidney is what they call the root or fabric of your internal functions, meaning everything stems from within the understanding of the kidney. This is like your embryological beginnings. If your body at large is very, very weak, you have no specific anything, you're just getting old and wearing out, that'll show up in the back part of your tongue as an age-related weakness, or just what they call the decreased jing, or decreased kidney functioning. So weaknesses in the back. Just like we have regions where you have sweet and sour and you taste salty, we have regions of disharmony related within tongue diagnosis that get into all these patterns. We're now going to blast through a bunch of full-color pictures of some tongues to demonstrate to you what I had just talked about. First, in looking at plate number 1, what we see is what would be considered a normal tongue with a slightly yellow coating, which would be indicative of the fact that the person has a slight internal heat caused by an external pathogen, such as a cold. What we're looking at in plate number 4 is that we're looking at the same thing, but this patient probably has no fever, but has a thick nasal discharge and is suffering from sinusitis. When we're looking at plate number 9, what we're looking at is a person that has deficiency within their system and also has swelling and water retention. When we look at plate number 13, what we see right here is that this is indicative of a person having internal heat and either stagnation due to a circulatory deficiency or a lack of movement of energy or chi in the body. When we look at plate number 12, it's similar to what I was mentioning before, where the heat within the body has actually burned off some of the normal coating and configuration of the tongue. This would be indicative of long-term weakness within the system. When we are looking at plate number 25, this would be indicative of a person that is having some form of digestive instability and has either an enzyme problem or colitis, would have some type of upper gastric reflux problem where they're getting either heat signs, but that it's not a long-term problem into there. What we're looking in at plate number 31, we're looking at someone who may have had a stroke recently. In the Chinese, we refer to that as internal wind, where we get a deviation of the tongue. Plate number 35 is of interest because, as I mentioned before, the scalloping or ridging of the tongue shows us that the person either is suffering from chronic weakness as far as digestive-wise or chronic overthinking. When a person has a black tongue with a thick coating like that, that usually indicates that a lot is going on within their system. The only time that is normal is that when we see a person have they're taking certain medications or certain sulfa drugs will turn the tongue black. However, within Chinese medicine, it indicates that there's serious internal functioning going on, and the prognosis is not great as far as is not good as far as what's going on at the time. Frequently, people with cancers or internal problems will have a black tongue like that, or people that are approaching near the end of their lifespan. What we're seeing in plate number 45 is that we're seeing paleness, which means a deficiency within the system due to chronic depletion of a person's energy and reserves, and we also see a yellow coat. Now that's very interesting because we're seeing what's in Chinese medicine is called a mixed pattern of excess and deficiency. The person is underlyingly in a weak and febrile state, but also is fighting off some form of heat or external pathogen. They may have some form of infectious process going on. What we're going to do now, I would like to introduce to you our special guest here today. And our special guest is Rhonda Hogan. And Rhonda Hogan holds a master's degree in acupuncture and holds a degree in traditional Chinese herbal medicine and traditional Chinese medicine. Rhonda, thank you for joining us today. Rhonda is a specialist in pulse diagnosis, and what's very, very interesting with Rhonda is that one of the ways in which she promotes her practice is that she goes around and she's at health food stores and she's at different locations, and people come and they line up, very similar to like a book signing, and she does that. She knocks out a whole bunch of people and does tongue and pulse diagnosis, and it's just very interesting to see. Rhonda, thank you for joining us today.
Thank you for having me.
Oh, and would you tell us a little bit about pulse diagnosis, how that all came about, and what's up there?
Well, in Chinese medicine, it was being practiced over 3,000 years ago, and back then they didn't have diagnostic procedures such as we have today. So the Chinese were very in tune to the body, and they used different forms of assessing the body, such as looking at the tongue and feeling the pulse. They also did abdominal palpation, where they would feel certain areas and look for tenderness or hard masses or just hard areas.
Regions that are constricted. Where is the pulse taken?
It's taken at the wrist on the radial pulse.
Okay. Now I was through my studies is that there's different pulses. It's not just a general pulse of whether how many beats per minute or how big it is, but that it's broken down into different organ systems and things like that.
Yeah.
How's that work?
Well, there's 27 different qualities, as you had mentioned that you can do the rate, but there's also different positions, and then you can check in the positions for those qualities, and each hand has different organs at the positions. For example, on the left hand, the first position is the heart, the second position would be the liver, and the third position is the yin aspect of the kidney. And on the right hand, the first position is the lung, the second position is the spleen, and the third position is the yang aspect of the kidneys. And then you can also feel, well, there's two levels. There's a superficial level and a deeper level. And those organs are the yin organs, and you would feel those at the deeper levels.
Okay. So when a person comes in as a patient, you take the history and their symptomatic complaint, and then you do tongue and pulse diagnosis together.
Yes.
And palpate, and that helps to formulate the diagnosis for the condition?
Yes. When a person comes in, there's often a lot of different complaints that they come up with. And you can come up with what we call a pattern of disharmony, which is basically a diagnosis in Chinese medicine. And then you can use the tongue and pulse to verify what the pattern of disharmony is, since a lot of the different symptoms can be conflicting. So you use the tongue and the pulse to get down to the bottom of what is really going on.
Now, does the pulse change frequently, or I mean, as far as what you're looking for quality-wise, or is this, how does that? Is that something where it changes after a treatment? Is this something that you use as an assessment as you go along?
Yeah, the pulse can actually change quicker than the tongue. It's something you have to take into account, because if a person is nervous when they come in to see you, it may feel different than once you get to know them. They might not be as nervous, so that could affect the pulse. Also, if they've just exercised, that could also increase the rate of the pulse, which can tell you, like, the speed of the pulse. If it's too fast, it can mean heat, internal heat. And if they've ran into your office because they were running late, it might be faster than it would normally be if they were sitting and relaxed.
Is it true that you can tell whether a woman's pregnant by her pulse? Is that something that you can tell?
Yeah, there's a quality called slippery, and often that's what it's a rolling, slippery pulse, and that's what you would feel if a woman was pregnant.
It appears as if the tongue diagnosis is a little easier to get a hold of than it is with the pulse. Does the pulse change throughout the course of the day, or whether a person eats?
Yes, it would. But regarding whether the pulse or the tongue is more difficult to study, the pulse is much more difficult. It's less precise, and it's much more subjective than the tongue.
Okay, because I find from my experience with this, it's that the longer I do it, I seem to be more on with it. I'm not making as many mistakes. I think when you see thousands of tongues, you really you're not overlooking into it. If it's there, it's there. If it's not, it's not. Are there differences between male and females in regards to pulse?
Yeah, the pulse in a male will be stronger overall because they have bigger hearts, but also there's the right arm tends to be the female side of the body and the left is the male. So in a woman, the right pulse will often be stronger than the left pulse, and vice versa for a man.
Really?
Yes.
Well, that's pretty interesting. Is it important to know whether a person's got high or low blood pressure when it comes to this tool, or?
It's a good thing to know because if the blood pressure is high or low, it could be a stronger or a weaker pulse, and you need to account for that regarding whether there's an imbalance within the body.
It seems like it's a very interesting study and something we can all integrate into natural health care. I hope that was interesting for you. For Natural Health Care Alternative, I'm Dr. James R. Golding, and thanks for viewing.